syndrome, what is that? Let's talk about it real quick. So normally conduction from the atria all has to go through this guy, the AV node, before going to the ventricles. With Wolff-Parkinson-White syndrome, you get a bypass or an accessory pathway from the atria into the ventricles. It's called the Kent bundle or the bundle of Kent. And that accessory pathway allows for depolarization to go from the atria to the ventricles without having to check in at the AV node. Well, remember what the AV node does is it kind of pauses that conduction to allow for ventricular filling. So if you think about it, when you go from the atria to the ventricles without going to the AV node, you're not going to pause and the ventricles will start depolarizing right away. But if it happens outside what we call these fast lanes of conduction, and it goes from cell to cell to cell, as it does in this case, it's going to be a little bit slower. So it'll widen that QRS as the depolarization continues into the ventricles from the accessory pathway. So with normal conduction, you get a nice P wave and a PR segment prior to the QRS complex. With WPW, you might have a P wave followed by that slurred upslope. Notice no PR segment. It goes right into the QRS complex. This is called a delta wave. So you'll get a delta wave. And what's happening is you're having normal conduction down the AV node as well as conduction down the accessory pathway. And that kind of creates this fusion beat, which shows us the delta wave. You also get a widened QRS because of that cell-to-cell depolarization that's occurring from the bypass tract into the ventricle.